Walter, I want to thank you very much for coming here to RCSI in Bahrain. We're delighted to have had you for the last few days. I'd like to introduce you to our staff here at RCSI Bahrain and give a background. And I think they're very interested in knowing some information about simulation, how it impacts on how the education simulation impacts on healthcare and many other items. So I'd like to introduce Professor Walter Eppich, who is a pediatric emergency consultant and has been in education research involved in education research for over 20 years. We're delighted, I think we're lucky to have him as the chair of RCSI SIM, Center for Simulation Education and Research.
It's a mouthful, isn't it? Yeah.
It is. So Walter, if it's okay, I'm just going to ask you a few questions.
Please.
Okay. So maybe if you can explain to us how simulation actually has helped in patient care.
Sure. Well, first of all, I think simulation provides an opportunity for learners to practice without risk to patients. So what that means is they can refine skills in a number of areas, either decision-making, behavioral skills, team skills, communication skills, before they actually try it out on patients. And that could be taking a history and doing an exam. That could be taking care of a patient, for example, who may have lost their heartbeat or lost their pulse and need to be revived or resuscitated. So there's a whole host of things. And specifically for me, I can remember a very telling experience when I was a pediatric emergency medicine trainee myself, because as I've mentioned to you, I'm a pediatric emergency doctor, and I remember having a simulation that was revolving around a severe life-threatening allergic reaction, which we call anaphylaxis. And we did the simulation. And one of the things I took away from the simulation was that you can give the medication, the shot, the adrenaline, more than one time if you needed to. And literally 2 weeks later, I had an 8-year-old girl who was with a known history of anaphylaxis who presented with severe anaphylaxis. And I knew as a result of the simulation that I could repeat the dose of the medication that mother had already given her at home. And that was, for me, a very powerful instance about how I was able to translate learnings from simulation into practice. And of course, since that time, back in the early 2000s, a number of studies have shown that if you rigorously train people in simulation in a number of key areas, it does translate to better patient care. So just a number of examples.
During your visit, you've run a course on staff development and training, and this has been extremely beneficial, and we've received great feedback. So, in your experience, what are the best teaching points for simulation educators to create a successful simulation experience for students?
Yeah. Well, I think there are three main things. First, creating a supportive learning environment, and what that means that helping the students feel psychologically safe so that they can take risks to perhaps be less than perfect, to make mistakes, risks to talk about things they're feeling unsure about, because we know that's where the learning happens, right at the edge of our comfort zone. So the psychologically safe and supportive learning environment that allows them to accept challenge, that's the first. The second would be to design scenarios that are focused on specific learning objectives. And these could be related to specific medical aspects or team aspects. In broad strokes, there's the work of caring for patients, and it's how we do it together. And I think it's always a balance of those two things. And last but not least, I think it's a high-quality debriefing, which is the conversation that happens after the debriefing, in which learners reflect on what they did well, what they need to improve on, and where educators, such as you and I, can focus discussion around specific areas that were particularly well done, or areas that need improvement. It can help people be even better and put their best foot forward the next time they encounter the same situation.
Okay. So can you explain how it impacts on the students' education? How does it facilitate their learning?
Yeah. Well, psychological safety, to give a little bit more detail, is really the belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. And as I mentioned, it's a place where learners can take interpersonal risk. And what does that mean? It means that they can say, I'm not sure about this. Or they can talk in an easier way about mistakes that they perhaps made in the simulation. And psychological safety is not something that's only relevant for simulation. It's also relevant for clinical workplaces. How do you tell someone who's supervising you that they may be making a mistake? How do you tell your boss that he or she may be wrong? And this is a lot of relevance for healthcare because we know there's a risk of wrong side surgery, things happening to the wrong patients. And often one of the things that contributes is communication problems, and speaking up, which requires psychological safety, is one of those things that happens in our full awareness. And so for me as a research topic, I'm very interested in how we create inclusive teams, inclusive to profession, level of experience, etc., that enable and promote speaking up behaviors so that the team can be at their best, which is not always easy, and yet without psychological safety, people will remain silent, and then the team loses, and most importantly, the patients lose. And so for students, that translates to an environment where they can practice at the edge of their expertise, which is where we know they're learning the most. So I think this has so many implications in education, both in simulation and in the workplace.
So if you were to give one advice to any simulation educator, what would it be?
My top tip is keep it simple. Very often people try to do too much. People try to discuss everything that happens in the simulation. So simple scenarios, and the debriefings need to be focused on a couple of key points. You cannot discuss everything. And this is one of the dilemmas we often face. And yet, with experience, you learn this is the quintessential aspect of this particular issue. And that's how we can help learners crystallize out for themselves a couple of key learnings that they can actually take away and implement into their practice.
So, just maybe focusing on one of the important or very important researches that you've got, one of the many. You did a study looking into the interactions of team performance. And if you could just tell me about that, because I think that's informed a lot of your work.
Yeah, well, I have a whole research program with some work in organizational psychologists looking at team processes such as team reflection, how teams reflect together to get better, and also team adaptation, which means how they can adapt in the moment in order to improve. And I believe the specific study you're referring to is a study we did in which we recruited 70 teams who participated in a simulation, and we analyzed how they work together. And teams that engaged in these team reflexive behaviors during the case, that means they would do things like recapping, summarizing, and importantly, team leaders would invite input from the team and encourage the team to speak up. That these teams showed better clinical performance as measured by a performance tool in the simulation. So it's promising. Clearly we need to do more work, but it's a first step to showing that these types of behaviors that we can train can benefit patients and hopefully, and this is the thing I'm working on, can promote our learning too. Yeah, so thank you for asking.
Thank you, Walter. This has been very informative. This has just been a small glimpse of what we've been having over the last few days, and delighted to have had you with us here.
And many thanks to you and your hospitality. Thank you.